All right, so we are now proceeding on from Tier 3, which is medication management, safety, and orders, to Tier 4, which is changes in patient condition, alarm management, and quality. So at this point, the orientee should continue to do all of the assessments and documentation, as well as administer medications for the entire patient assignment. But at this time, there is a focus more on safety and quality as they continue that care. So this, as a preceptor, you will then incorporate, information about, looking at changes in patient condition or patient deterioration. Also look for opportunities for blood transfusion, interventions to prevent CLABSI and CAUTI, caring for a patient with C. diff, and also hourly rounding to prevent falls and injuries. Be sure to also discuss sepsis and the 4-eye skin check to prevent pressure injuries. After Tier 4, you'll then move on to Tier 5, which is delegation, teamwork, and communication. And also during this level, you want to focus on admissions, discharges, and transfers. So the orientee will do all of the care, as mentioned before, for Tiers 2, 3, and 4. And then there's a focus on learning how to delegate, communicating with the interprofessional team, and being able to transfer a patient to another unit or level of care, or receive a patient from another unit or level of care, as well as admit or discharge a patient. You also want to focus on the SBAR communication during this tier and bedside shift report, and that they understand how to report critical findings and document that in EPIC. During this time, you'll also discuss how to report any safety incidents and to delegate appropriate tasks. The final tier, Tier 6, this is clinical judgment and practice management. And at this point, the orientee should be taking ownership for all of the patient care that's involved for the full patient assignment. So at this point, it's a complete switch from, Tier 1, where they were observing, where now the preceptor, you will be observing and ensuring that they're delivering safe and quality care. And, so there are objectives to focus on, such as, the ability to locate resources that are needed, demonstrates awareness of their own scope of practice. Also, that they know the scope and standards for your specialty area. And please note that you can find these online. They are available on Careline, as well as you can Google for a PDF copy of the scope and standards from ANA and AACN if those are applicable to your unit. And as I mentioned, please ensure that you use the communication box and fill in any activities that are appropriate. And you will be doing the weekly the weekly evaluation, which we'll look at in just a moment. Now, as I mentioned, there is the skill tracker. So this skill tracker is for Med-Surg. This is not a checklist that has to be completed prior to exiting orientation, although we would like this completed. The goal for completion is within 6 months of the hire or transfer date. And, these are skills and experiences that are important for the orientee to track and be aware of. So this first box here, you'll see there are some, IV insertion, blood administration, just basic nursing skills, that the nurse will need regardless of the Med-Surg unit. You can also add in additional unit-specific skills as needed. This next section are things that can be reviewed with you, the preceptor, or they can be reviewed with the clinical specialist, but ensure that they know how to access their email, that they know to check their email at least once a week, that they know how to use UKG, maybe show them how to download the app, how to access Workday for any learning that may be available for them there. And as I mentioned, the resources that are available on Careline. A downtime process, that's also important. Maybe you don't have a downtime during one of your shifts, but you can still discuss that with them. Also, showing them that document manager, and some of these are just some suggested policies that you can show them that you may need frequently. You can discuss professional governance in the clinical ladder program with them, although it may not be on their radar just yet, but at least, letting them know that it exists. The remainder of the document is just some things that you may want to go over with them, as well as the clinical specialist may want to discuss that with them. And these are things that can be completed anytime as you progress through orientation or even after orientation. Some of them are system specific, as well as stuff that pertains just to emergencies or special procedures. Now, before I move on to the weekly evaluation, I want to show you the Lassiter Clinical Judgment Rubric. And the weekly evaluation, it's going to ask questions that are related to this clinical judgment rubric. So both the preceptor and the preceptee will be evaluating, how the orientee is doing in each of these. So for example, focused observation, and you can see there's a description in each of these boxes that explains what that means. Okay, the first row, this is exemplary. So this is like, should not be there until they're nearing the end of orientation. And then over on the right hand side in this column, you'll see this is beginning. So this is just starting out. So with focused observation, in the beginning level, confused by the clinical situation, amount and type of data, observation is not organized and important data is missed and or assessment errors are made. So this is where you're going to evaluate once a week, where is that orientee, where's that preceptee falling along these lines here. Then recognizing those deviations from expected patterns. Again, in the beginning, this is probably where most of them are going to be unless you are precepting a more experienced nurse. And that's okay. That's completely okay. But this is a great way just to sort of glance and see where they're at, and also help them have goals and see where they're going and how far they've come. And, by the end of the orientation, we want to see them somewhere along the lines between accomplished and exemplary. We would want them, hopefully, to be along these lines. Are they seeking information? Are they able to prioritize data and make sense of it? And here's the second page. Are they responding in a calm and confident manner? Are they able to clearly communicate? Are they flexible and able to, implement interventions? How are they in their nursing skills? And are they able to self-analyze and evaluate? And are they making goals? Are they committing to improve week to week? So I'm just going to pop back up here and show you, again, this is on the second, third page, I think, of your of the orientation tool. You can either scan this code with your phone or click on the link and it will take you directly to the evaluation, which we'll check out now. So when you go to that evaluation, you'll see that there are instructions at the top for the preceptor and the preceptee, and you'll go in and fill out, read through this information, and you'll complete each section. So what hospital are you at? Which unit are you on? Identify the name of the preceptee as well as the preceptor. Then you'll also come down and identify which tier that they're on. And if which evaluation you're filling out. So are you the preceptor or the preceptee? So as I showed you that Lassiter clinical judgment rubric, you'll see that we have a little snapshot of each thing here, just in case you don't have a copy of it with you. So you can glance over this and you can see, all right, so this is the focused observation that we were talking about. If I'm on tier 2, I may be somewhere around beginning or developing. So then you'll just click that. Then you'll move on to the next one. And again, it's got the information snapshot there for you, and you'll click on each one of those and evaluate the orientee. I'm going to scroll on down. Now, so this is asking, were you able to meet your goals? So what did your orientee, were they able to meet their goals? And what are the goals for the next week? And, jot that down as you're going through. This can also be a spot where, as the preceptor, you can include any feedback that the clinical specialist or the manager may need as well, because these responses will go straight to them. So on that note of communication and feedback, I'm going to take just a couple of minutes to discuss that. So it is important to have effective communication. It can be very difficult, especially when we're busy. There's a lot going on. But to have effective communication, we have to ensure that not only are we giving information, but that the information is understood by the receiver. And a great way to ensure that happens is having your orientee be able to kind of repeat back or provide a summary of what you've said, just to ensure that you're on the same page. So be sure to choose your words very wisely, as well as actively listen to what's being said. Try to pay attention to your body language, most especially, as we portray much more communication through our body language than we do by what we actually say. The tone and inflection is also important. If you're writing down feedback, remember you can write less and say more. So we want to provide, the most objective details, and instead of all of the subjective, how I felt or how I think that person felt, etc. And know whenever you've said enough. I love this, the 7 C's of communication. We want to keep it courteous, clear, correct, and we can do this if it's objective, right? We keep it objective. Complete, give the complete story. That there's facts, it's concrete, concise, and coherent. So important things to communicate with the orientee are going to be the goals for orientation, but they also need to be aware of what are the unit goals. What are the things that we're trying to focus on? Be sure to share that with them as well as you go along through the orientation process. You do have to let them know where those weak areas are, and I know it's difficult, but if we want them to grow and become stronger nurses, we have to identify those weaknesses. And you can also ask them, what are your weaknesses? And maybe this is a great way to do that instead of just saying, look, you're not good at this, but what are some areas that you would like to work on? Or what are some areas that you feel you need to strengthen? Ask them what their learning needs are and what prior experience or knowledge that they have. So obviously, if they're a new graduate nurse, probably not much. But if it's an experienced nurse, they probably have a lot to bring to the table. And even if it is a new graduate nurse, we also want to know what their prior experience is, because they still can bring things to the table. For example, you think about someone who may have worked in retail. They know customer service. If they've worked as a server, then they know how to help meet needs. So don't negate that. Don't negate their prior experience. We want to give them autonomy in that, by asking them, how are things going for you? Right? What can you take ownership of in this experience, and not just tell them what to do? focus on prioritizing and how they're doing. And again, that active listening. This is going to conclude part 2. And if you'll please proceed to part 3.